to 3% of all births worldwide are multiples. The majority of these, around 97%, being twins. Twins are two offsprings of fetuses produced by the same pregnancy. In contrast, a single fetus that develops alone in the uterus, the much more common case in human, is called a singleton. The word multiple refers to producing more than one fetus in the same pregnancy. How do twins happen? There are two ways you can end up with twins. The first way is that you actually ovulated two eggs fertilized by two different sperm, forming two separate zygotes, then two separate embryos. Because they emerge from two separate zygotes, they will be called dizygotic twins. This means that you are basically experiencing two different pregnancies in one uterus at the same time. We also call these first twins or fraternal twins because they are really two different siblings, two genetically different pregnancies at the same time but in one uterus. They can both be boys, they can both be girls, or they can be one of each. For example, Esau and Jacob, sons of Isaac in the Bible, were fraternal twins. And most importantly, because they started out as two different entities, they absolutely each have their own placenta, their own amniotic sac. They are just experiencing crowding uterus at the same time. Because of this, they are called dichorionic diamniotic twins. Chorion in Latin means placenta, and the amniotic refers to two separate amniotic sacs. So dizygotic twins, also called fraternal twins, are absolutely and initially dichorionic twin and diamniotic. Though in some cases placental fusion can happen later in pregnancy, making two different placentas appear as one. When two or more eggs are released at the same time in one ovulation, this is called hyperovulation. Heterotopic pregnancy is an extremely rare type of dizygotic twinning in which one twin implants in the uterus as a normal intrauterine pregnancy and the other remains in the fallopian tube as an ectopic pregnancy. The ectopic pregnancy must be resolved because they are life-threatening to the mother. But in some cases, the intrauterine pregnancies is preserved. The second way you can end up with twins is by ovulating just one egg. And that one egg is fertilized by, and no longer after being a zygote, is split right down in the middle from one into two entities. Because they split from one fertilized egg or zygote, they will be called monozygotic twins. Splitting from one to two is quite an amazing thing, meaning they will share the same genetic information and the same external features such as same sex, hair type, blood group, eye color, and other physical and even psychological features. For this reason, they are also sometimes called true twins. What's really interesting is that if the splitting mechanism happens really quickly and efficiently, and then they will split all the way down in the middle and form separate fetuses, separate amniotic sac, and separate placentas. So though identical twins only split or monozygotic, just like fraternal twins. However, and unfortunately, if they split late, they might end up sharing some part, either the placenta alone, either the placenta of the amniotic sac, and even the worst scenarios, the split can fail to complete, ending up in a conjoined twins formation. For a better understanding, let's make a short recap on embryology. When ovulation happens and the released egg is fertilized by male sperm, the NET formed is called a zygote. The zygote then migrates from the fertilized site in the fallopian tube to the uterus where implantation will take place. During this tubal migration and early, during, and after uterine implantation, the zygote then embryo will change names according to various steps that will lead to a pregnancy. 3 days after fertilization, a healthy embryo will contain about 6 to 10 cells, and it will then be called a morula. By the 4th to 8th day, the fertilized egg is known as a blastocyst, a diving ball of cells. A blastocyst is a class of diving cells made by fertilized egg. A blastocyst is one of multiple steps that will lead to an established pregnancy. The blastocyst contains an inner layer called the embryoblast, an outer layer called the trophoblast. 7 to 8 days following fertilization, the trophoblast on the outside differentiate into 2 cell layers, the cytotrophoblast and the syncytotrophoblast. Because these cell layers are responsible for establishing the fetal part of the placenta, the moment the embryoblast divide into 2 affect how cytotrophoblast and the syncytotrophoblast will develop to protect the embryo. Between 13 and 15 days, embryoblast forms an embryonic disc to form different fetal body parts. So it's agreed upon the fact that monozygotic or identical twins develop or split from day 1 to day 13 following fertilization. If the split or cleavage happens 2 or 3 days following fertilization, the identical twins will be diaclonic and diamniotic, meaning that 4 identical or monozygotic develop like fraternal twins, completely separately from each other, receiving oxygen and nutrients from separate placentas and swimming around their amniotic sac each. If the embryo divides 4 to 8 days following fertilization, the twins will be monochorionic and diamniotic, which means that the trophoblast is already differentiated. So they will share a single placenta but on 2 separate amniotic sacs. If the embryo split 8 to 13 days after fertilization, the twin will be monochorionic and monoamniotic, meaning that they will share the same placenta and grow in the same amniotic sac. Remember, chorion means placenta and amniotic refers to amniotic sac. Conjoined twins are a result of an attempt for the embryo to split after 13 days following fertilization. When a multiple pregnancy involves 2 fetuses, it's called a twin pregnancy. When it involves 3, it's called triplets. 4 quadruplets, quintuplets, 6 sextuplets, 7 septuplets, octuplet for 8, nonuplet for 9 fetuses, etc. Triplets and other high-order multiples can be identical, fraternal, or a combination of both. Genetics and training. Women who have a family history of fraternal twins have a high chance of producing fraternal twins themselves, as there is genetically linked tendency to hyperovulate. However, there is no non-genetic link for identical twinning. Risk factors. one triplet pregnancy just happens. In other cases, specific factors play a role. For instance, a twin pregnancy is more likely as you get older because hormonal changes can cause more than one egg to be released at a time. Use of assisted reproductive technology such as in vitro fertilization also increases the odds of twins or other multiples. Twins are also observed more in the black than in other communities. For instance, the Yoruba people in West Africa have the highest rate of twinning in the world at 45 to 50 twin set, which is 90 to 100 twins per 1,000 live births. North America and Europe have intermediate rates of 9 to 16 twin set per 1,000 live births. Multiple pregnancies are much less likely to carry to full term than single ones, with twin pregnancies lasting on an average of 3 weeks earlier than full term. Diagnosis. Most twin or multiple pregnancies are currently discovered early in pregnancy thanks to ultrasound scan. But a multiple pregnancy can be clinically suspected in the second half of pregnancy when the uterus is abnormally large and does not correspond to the gestational age, or one or two multiple pole types are felt, for example, two heads, but two distinct hard tones are heard. And ultimately, the diagnosis is usually confirmed by ultrasound. And sometimes a seemingly normal twin pregnancy diagnosed early in pregnancy is later found to have only one baby. This is known as vanishing twin syndrome. Such an episode can be heartbreaking, frustrating, and confusing. And often, there is no clear explanation for the loss. So what does multiple pregnancy means for the mother? Being pregnant with multiple pregnancies takes special care. Know what to expect from nutrition and weight gain to possible complications. Taking care of yourself is the best way to take care of your babies. If you are carrying multiples, you can expect: number one, more frequent checkups to track your baby's growth and development, monitor your health, and watch for signs of preterm labor. You might need frequent ultrasound or other tests, especially as your pregnancy progresses. Number two, more weight gain. Gaining the right amount of weight can support your baby's health. For twins, the recommendation is typically 37 to 54 pounds, which is about 17 to 25 kilograms. For women who have a normal weight before pregnancy, this will be accomplished by eating an extra 600 calories a day. Work with your nutritionist or your healthcare provider to determine what's right for you. 3. A risk of earlier delivery. Complications. Healthy multiples are born every day, but still it's important to be aware of possible complications. Some possible complications are: for the mother, vomiting in pregnancy. If nausea and vomiting are common in pregnancy, carrying twins or multiple pregnancies increases the risk of developing such symptoms. Number 2, high blood pressure. If you're carrying multiples, you are at increasing risk of developing hypertensive disorders in pregnancy. For the fetus, chimerism, parasitic twin, fetus in fetal, partial molar twin, 8. Miscarried twin. Occasionally, a woman can suffer miscarriage early in pregnancy, and yet the pregnancy continues. This means that one twin was completely miscarried, but the other was able to be carried to term. This is similar to a vanishing twin syndrome, but of later occurrence. And if the miscarried twin is retained, there is increased risk of congenital malformation in the surviving twin. Number 9, twin-twin transfusion syndrome. If twins share the placenta, it's possible for a blood connection to form in a shared placenta. This can result in one baby receiving too much blood and the other too little. One twins called the donor becomes dehydrated and anemic and suffer from poor fetal growth, while the other twin called the recipient develops high blood pressure and heart failure. Twin transfusion syndrome is a disease of the placenta. It's a serious complication that can lead to fetal death of one or both twins. Surgery is sometimes needed to treat the condition. 10. Stillbirth. The rate of stillbirth is high in twin and other multiple pregnancies. The more babies you are carrying, the less likely you are to carry your pregnancy to term. If you have signs of preterm labor, you might be given injections of steroid medication to speed your baby's lung development. Even then, your baby might experience complications including breathing and digestive difficulties, vision problems, and infection. It's common for twins to be born at low birth weight. More than half of twins are born weighing less than 2.5 kgs, while the average weight of a healthy baby should be around kilograms. This is due to the fact that twins are habitually born premature. 13. Risk of cesarean section delivery. For twins, vaginal delivery is often possible if the first baby is in cephalic presentation. If not, a C-section might be recommended. In some cases, complications after the vaginal delivery of the first twin might require cesarean section delivery for the second twin. For triplets, quadruplets, and high order multiple pregnancies, the more common route of delivery is a cesarean section. And irrespective of the mode of delivery, twin and other multiple pregnancies increase the risk for the mother to develop a postpartum hemorrhage or excessive bleeding during or after childbirth and postpartum depression. For more information, please watch videos on this condition on the channel. If the delivery of triplets and high order multiple pregnancies are usually done by cesarean section after 34 weeks pregnancies, depending on the clinical scenario, delivering twins in terms of how and when remains subject to a multidisciplinary medical team appreciation in collaboration with patients and in accordance with the clinical scenario. For instance, for otherwise healthy twin pregnancies, where the both twins are in cephalic presentation, a vaginal delivery is recommended. Vaginal delivery does not worsen the outcome for the infant as compared to a cesarean section. But there's still a controversy of the best method of delivery where the first twin is in cephalic presentation and the second is not. But in effort to reduce the dramatically increase of cesarean section rate, most guidelines recommend a primary vaginal delivery. When the first baby is in pre-presentation, a cesarean section is recommended. For monochorionic twin, delivery at 36 to 37 weeks may be considered. In summary, fraternal twins, the most common kind of twins, occur when two separate eggs are fertilized by two different sperm. Each twin has his or her own placenta and amniotic sac. The twins can be two girls, two boys, or a boy and a girl. Identical twins. Identical twins occur when a single fertilized egg splits and develops into two fetuses. Identical twins might share a placenta and an amniotic sac, or the twins might share a placenta and each have separate amniotic sacs. Genetically, the two babies are identical. They will be of the same sex and share physical traits and features. I am Dr. Eric. This channel provides information that promotes health and holistic wellness as well as lifestyle safety tips. All the information delivered on this channel is tailored for comprehensive health educational and informational purposes. If not done yet, subscribe now and hit notification bells. We hope this video on multiple pregnancies was helpful, and we hope to see you soon in our next episode.